What's the significance of the study?
Well, it's important because the majority, if not all, of previous MDMA studies have looked at samples of MDMA users that have used other drugs, and so because of that, these other drugs are confounding, or they confuse the picture. So we don't know that any changes in an individual's behaviour or, for instance, performance in a task are due to MDMA, ecstasy, or are because of these confounding factors, other drug use.
And what about the sample size? Are 52 ecstasy users versus 59 non-users too small a sample size?
I wouldn't say so. I think that's large enough for that kind of study. It is difficult to get sample sizes, large sample sizes of MDMA users, and so it's actually quite impressive sample size, I would say.
With regards to its classification as an A-level drug, do you think this is the right classification for it?
Okay, so that's a very complicated question. I think the classification system in general is problematic, and most people feel that way, most scientific people feel that way. I think if the argument or the question is MDMA more harmful than drugs that are classified lower than it, then I would say no, that's not true. There are other drugs that are more harmful than MDMA, which are classified below it or are unclassified, like alcohol. But it's a difficult issue because it's a complicated one. For instance, if the MDMA was made unclassified, if it was legalised, then we may see a different picture in terms of harm, in that it's likely more people would use it. It would be unknown what their pattern of use would be, and if that was excessive, then we might see harms associated with that excessive use of MDMA, and as a result of increased use, we might come to see it as a more harmful drug. So it's a complicated one. It's not an easy one to answer.
What about people who say that it should be classified as an A-level drug because people might do things on it that would hurt them? So the drug itself might not have consequences, but it could cause them to do something.
Yeah, I wouldn't agree with that, actually. MDMA seems to be quite a pro-social drug, whereas although alcohol is good for lowering social inhibitions and such like, it's also associated with a lot of social harms. And so I would actually argue that looking at that factor of sort of harms while intoxicated, I really think MDMA would be quite low on that factor in terms of harm, and actually maybe high on benefit.
So in that case, why is it classified as an A-level drug?
It's a good question. I don't think a good answer has ever been given by those who've classified it there. There's a kind of ignorance, I suppose, around certain kinds of drugs, hallucinogenic drugs, psychedelic drugs, and I think perhaps MDMA was bracketed in with those. Maybe it's an effect of that. I don't really understand, to be honest, why it's a Class A drug.
What about the campaigns that have been saying that ecstasy creates holes in the brain?
Well, that's absolute nonsense. That study was problematic in itself, and it's been bettered by a number of studies since. And that was a classic example of media misinformation. So they latched onto something which wasn't even an inference of those who carried out the study, and they reported this finding which just simply wasn't there. It wasn't true. There certainly weren't holes in the brain, so that's a nonsense. That's pure misinformation.
Okay, so it sounds like overall there's a pretty sort of positive message about MDMA. Are there any reasons not to take it?
I was so tempted to say no there. There are good reasons for not taking it too regularly, I would say. Yes, there are good reasons for not taking it too regularly, because it does cause a short-lived depletion of serotonin, an important chemical, important neurotransmitter in the brain that's important for regulating mood, and there's a simple general association between serotonin levels and mood. So if serotonin levels are high, then we're more likely to feel, have more positive mood. and there is evidence that MDMA does lower serotonin levels for a certain amount of time after taking the drug. So that's not something which is entirely positive necessarily. However, the levels recover quite quickly. There is an association between extent of use and the extent of this degeneration or damage to the serotonin cell fibres, and so that suggests that people shouldn't take MDMA too much. And also there's good evidence that the time between taking MDMA determines the extent of the damage. So there seems to be recovery of the serotonin axons, and so that would again suggest that MDMA shouldn't be taken too regularly. I wouldn't endorse taking MDMA. Oh God. I wouldn't endorse taking MDMA recreationally. It is an illicit drug. But my interest, I think the appeal and the positive thing around MDMA is its potential application in psychotherapy. The results of the study that's just been published kind of support that case, the case for looking at MDMA as a drug that can assist the psychotherapeutic process. So the rationale is that it lowers inhibitions in such a way, or really it lowers anxiety and fear associated with painful memories and traumatic memories, and so it allows a patient to reappraise what's happened to them and to revisit it, because a lot of these patients can't do that. It's too frightening, it's too overwhelming, and they can't revisit it, even in a supportive psychotherapeutic environment. They'll just dissociate from it, and so MDMA induces this state of kind of trust and empathy where they can do that, and I think that's very positive. And then again, if the potential benefits of that outweigh the harms or the costs, which this recent study seemed to be suggesting the harms aren't substantial, then there's a strong case for looking at MDMA in psychotherapy.